everyone. Thank you for joining us today. This program is brought to you by Regional Dairy Specialists of the Cornell Cooperative Extension. Today, we will be discussing critical calf care, decision-making for urgent dairy calf health situations. This is episode 1, where we will cover common health issues, identification, and disease progression. This is the first episode in a 7-part series. We hope that you will join us for the rest of our sessions. And please note that recordings will be posted on the Northwest New York's YouTube channel. As a reminder, this content has been approved by the National Milk Producers Federation, SARM team, as continuing education. Add your participation in this program to your records for your next animal care audit. Today's presenters are Casey Havakis with the North Country Regional Ag Team and myself, Alicia Durinke, with the Southwest New York Dairy, Livestock, and Field Crops Team. Before we jump in, we do want to remind everyone that we are not veterinarians, and the material presented today is for educational purposes. We strongly encourage all farms to have a veterinary client-patient relationship and that you consult your veterinarians as a need arises. In this specific episode, we will cover common health issues and illnesses, recognizing and diagnosing diseases, health and behavioral indicators, disease progression, including monitoring diseases, as well as early intervention. So we would like today to offer you some interactive opportunities and some time to reflect on your own farm's practices. So we've incorporated some chat questions. Our first question today is, how frequently do you have health concerns with your calves? 1, we never have health concerns. 2, we have health concerns about once per month. 3, we have health concerns about once per week. And 4, we almost always have a health concern present on our farm. So calves are highly susceptible to disease due to a lack of immunity, which builds up over time. The initial defense that a calf has is their immunity from passive transfer, which is what makes colostrum such an important aspect on your farm. There are some diseases that are more commonly a problem at specific time periods throughout a calf's life. And ideally, your management should help you reduce the amount of times that you have health events or any sort of concerns with your calves. And research has shown that how you make management decisions does influence your calf's health and productivity. However, even on the best of farms, accidents can happen or there are exceptions to the rule, and you may end up with a sick or an injured calf. It's just important to do your best to prevent that, as well as address any issues that do arise. And so let's review a couple of common issues and illnesses that maybe some of you have likely seen. And this is not an all-encompassing list, but just a quick overview of some common issues. So probably many of you have had concerns with either pneumonia or respiratory disease in your calves, scours, or possibly contracted tendons. And these are some fairly common issues that we will see arise on farms. According to the NAHMS 2014 survey of operations that administered any sort of microbials, digestive and respiratory diseases were the most common diseases affecting pre-weaned calves, with digestive diseases occurring at a rate of 21.1% and respiratory diseases occurring at a rate of 12%. And this trend carried over into the heifer stage as well, with the digestive diseases affecting 16% of heifers and respiratory diseases affecting 11.4%. And additionally, there are some less frequent issues that can arise that need to be addressed when they do happen. So this can include things such as hernias, birth defects, and navel infections. And hopefully you don't see a ton of these on your farm. If you do, then maybe that means you need to address something in your management.
So when you see this picture, it's hopefully obvious to you that the calf does not look quite right. So go ahead and throw some comments out in the chat box about what you see wrong with this calf. We'll go ahead and give you a few seconds to put your comments in, and then we'll go ahead and discuss it. So as I mentioned, just by looking at the calf, you can hopefully tell that things aren't quite right with her. So what I see when I look at this picture is droopy ears. She seems a little bit depressed and her coat looks a little bit rough. And those are observations just off of a picture. But I'm sure that if this was in real life, we'd see maybe she's dehydrated, she likely has a temperature, maybe her back end is soiled with loose manure, and so on and so forth. So the point I want to make here is that there are a ton of physiological indicators that this calf might be sick. In this list here on this slide does not encompass them all, but it's just some of the more common ones. So we have things like a temperature, eye goop, fecal score, skin tint, overall attitude, navel, joints, ear droop, and if there's any nasal discharge. So when we're looking at health indicators, it can be very overwhelming, and sometimes we may be unsure of what exactly we should be looking for, or maybe you're overwhelmed with the abundance of resources that are out there, and that's okay. There are a lot of variations of health scoring charts that may take some or even all of the health indicators that I just mentioned and put them into a scoring system, whereby you essentially give a calf a score for each area, and then depending on the chart, you'd add up the score and use it to assist you in your decision making. So we're actually pretty lucky to have so many great resources at our fingertips when it comes to calf health scoring. We are not here to tell you that one is better than another. We just want you to pick one and go with it and use it to help with your decision making. So this is an example of the Wisconsin Health Scoring Chart, which is a very popular resource. So this chart in particular assigns calves a score of 0 to 3, with 0 being normal and 3 being a very compromised calf. And you can see here that this chart scores temperature, cough, nasal discharge, eyes, ears, and finally fecal. So then what you can do with this type of information is make management and treatment decisions based on how the calf scores. So I know this might be a little bit hard to read, but what this chart is saying is that if your total respiratory score is 4, you should watch her, or if it's 5 or more, you should treat her. And then the same thing for fecal. So if she's scoring a 2 or a 3, this particular recommendation is to treat her. So again, this is just an example of what you can do with these calf health scoring charts and how you can use them in a practical setting. And the cool thing with Wisconsin's health scoring system in particular is that it's actually available as an app through the iTunes store. So this is a very user-friendly app, and it allows you to keep electronic records of the calf and notes or any observations that you want to make. And then you can also make a list of calves that you need to treat, which is convenient and very helpful, especially if you have a lot of calves that you're responsible for. So here's another example of a health scoring chart, and this example was used by researchers, specifically Lau and colleagues in 2019, and it has a few more categories. So that's not to say it's better or worse than the Wisconsin one, it's just different. And some of the things that are incorporated in this chart might be more helpful to some farms, and it might be more practical for some farms. So for example, this one doesn't just include ocular discharge, but it also measures how sunken the eyes are, and it looks at the calf's coat and overall appearance. It also accounts for gut fill, which is a unique aspect of this scoring system. And then lastly, this example is from the Calf Care Corner based in Ontario, Canada. So this scoring system takes into consideration some behaviors like appetite, but rather than assigning calves a score, it just indicates what the calf should be doing or look like if she is healthy versus if she is sick. So I know this one's also a little bit hard to read, but we will put the links to all of these in the chat box in case you would like to access them or print them and use them on your farm. Again, this chart is a different style, but the information is just as valuable, and it can better suit the needs and management styles of some farmers. So once again, pick the one that works best for you and go with it. So let's go back to our original question. What physiological signs should we be looking for with disease? And it can easily become overwhelming when you have all of these different scoring charts and visual assessments. But at the end of the day, the calf's attitude, appetite, and visual appearance will tell you a lot about the calf's state. And if you observe from that that she seems off, then it's going to be worthwhile to score her using one of these systems. And it's also very important to remember that it's not just physiological indicators that are useful for identifying disease. The calf's behavior is equally as important, and Alicia is going to touch on that next. So before Alicia takes it over, we have our second chat question, which is how frequently do you observe physiological health indicators in your calves? So throw something in the chat box depending on your response. So you can pick a 1 if you never observe them, 2 if you observe them when you notice an issue, 3 if you're making observations monthly, 4 if you're making observations weekly, 5 if you're making observations daily, and then 6 if you're making observations more than once per day.
So as Casey mentioned, in addition to the physiological signs of disease, calves will also exhibit a range of behavioral changes when they're ill. And oftentimes, these behavioral changes can be identified earlier than many of the physical signs that a calf may present. So it really makes it extremely important to pay close attention to what your calves are doing and knowing if they are going to deviate from normal, especially with their behavior. So while many folks probably recognize that a calf not drinking is a behavioral response, there are a lot of additional changes that can be observed and recognized, including human interactions, grooming, feed intake, isolation, the posture the calf is utilizing, water intake, play behavior, if the calf is lying down a lot. And all of these can be utilized to help identify if your calf is healthy or if they are potentially experiencing a health event. So looking at feeding behavior, specifically with milk, we will see a decrease in the quantity of milk consumed 3 days prior to any sort of clinical signs of disease. After clinical signs are present, milk quantity will decrease, as well as the number of visits to an auto feeder and the length of those visits. And then also the number of unrewarded visits are lower in calves for 7 days after they've had clinical signs of disease. It's also important to note that sick calves will take longer to drink. Looking at solid feed consumption, this will also decrease with the presence of clinical signs of disease. For water consumption, we will see an increase in the number of visits that a calf makes to the water trough prior to any sort of clinical signs of disease. This makes it especially important to keep clean, fresh, free choice water in front of your calves to help make sure they're staying hydrated, especially if they're going to experience any sort of health event. Calves will also decrease the number of lying bouts that they have while increasing the duration of those bouts. This means that rather than standing up and lying down a bunch of times throughout the day, calves will have longer spurts of lying down. At times when calves are standing, they will also be standing with a slouched posture, meaning that their head is likely below their shoulders. Sick calves will also self-isolate, decrease their approach to humans when they enter the pen, and calves will also change their posture less when a human is around. So rather than standing up and getting excited as soon as a human enters their pen or comes near them, calves will typically remain lying and avoid approaching that human. We will also see a decrease in self-grooming behavior in sick calves. So it's important to highlight that research shows many of these behavioral changes will occur prior to any sort of clinical diagnosis, making it important to monitor your calf's behavior. And monitoring your calf's behavior can help you identify an issue earlier on in the onset, making sure that you can have some sort of early intervention, which will likely improve your outcomes of treatment and likely decrease the cost of that treatment overall. It can also be really easy to observe your calf's behavior. You can either utilize some sort of technological approach, such as activity monitors or data from auto feeders, or you can simply have somebody take the time to do some good old-fashioned human observations in person. It's important to maintain records of those behaviors so that way you have something to look back on when you think a calf may be deviating from normal. So for our third chat question, we want to know, how frequently do you observe behavioral health indicators in your calves? So 1, we never observe behavioral indicators. 2, we observe them if you notice that there's an issue. 3, behavioral indicators are observed monthly. 4, weekly. 5, observed daily. And then 6, you observe your calf's behavior more than once per day.
Okay, so when it comes to diagnosing disease, there's a lot that goes into it. And as Alicia mentioned at the start of this webinar, we are not vets. So it's very important that you have an up-to-date VCPR and that you're using that when you make management decisions. But we also recognize that you're not going to call your vet every time you have a sick calf, and that there are several management strategies to implement before you resort to calling the vet. There are also some calf-side diagnostic tests for calf scours, and they're still being validated and they're not available for use in the US yet, but hopefully that'll come down the road and that can be helpful for making decisions on your farm. So this is an example of how you can diagnose pneumonia or respiratory issues. So this is a scoring system developed by the University of Wisconsin, and you're basically going to assign a score to the calf based on these areas. So if she has a cough, you're going to give her 2 points. If she has a fever above 39.2, you're going to give her 2 points. If she has nasal discharge, you're going to give her 4 points, and so on and so forth. So what these researchers established is that if a calf scores a total of 5 or higher, you're going to classify this as a respiratory case. And then you can use that knowledge to further make your treatment and management decisions. Another example for how you can diagnose disease is this chart for infectious causes of diarrhea. So this chart tells you the typical, and I stress the word typical, because of course there are outliers and you can't use this every single time, but this chart shows the typical age range when calves are infected with each pathogen. So this can be very helpful in making treatment decisions, as we know that viral diarrhea is not going to respond to antibiotics, and so there's not going to be any sense in treating that calf if they're in that later age range when they're likely experiencing rotavirus or coronavirus. So I actually have an exploratory research project on the go right now up in northern New York, looking at the pathogen that causes diarrhea and associating it with antibiotic usage. And what I'm seeing is a majority of the time, the calf does not necessarily need to be treated. And as I just mentioned, there are some calf-side tests being validated, so I think there's more work to be done on this area. But I think it's really important to note that your first line of defense for scouring calves shouldn't necessarily be antibiotics. And what we're going to recommend is that your first line of defense is water and electrolytes to keep those calves hydrated. And that's going to be covered in more depth in episode 4. So once you've identified a sick calf, it's very important to pay careful attention to her, as one issue can very quickly lead to another and or worsen. So once she becomes sick, her immune system is going to be compromised, and then she's going to be more susceptible to other diseases that could follow. So you really want to make sure that you're paying attention to her. And when you're working with calves in a group, one strategy could be to use a colored collar that's going to stand out so that when you're observing the calves, you don't have to look for every ear tag with that calf's number, but rather just look for the colored collar. And then if your calves are individually housed in hutches or in individual pens, you could place a colored clothespin or put colored duct tape on her hutch or her pen. And you could even get as specific as making one color for one type of disease. So for example, red for pneumonia, blue for scours, and etc. So as we wrap up, we just want to remind you of some key considerations. So first and foremost, calves are highly susceptible to disease. And you want to be paying attention to both physical and behavioral indicators in order to help you identify sick calves. And you want to make sure that you're identifying them as early as you can, because early intervention will improve the outcome. And lastly, once you've identified a sick calf, make sure that you're monitoring her frequently for changes and other further signs of illness. So that concludes this first session of our Critical Calf Care series. Thank you very much for tuning in and listening. You are more than welcome to submit questions to the question and answer feature of the Zoom webinar. And please join us for our next session where we will discuss dystocia and difficult calvings, and that will happen next Tuesday, January 12th, 2021. And you can use the same Zoom link to access that webinar.
Okay, as you all are submitting your questions to the Q&A feature, I do want to bring your attention to our other two presenters that are joining. Margaret Quasdorf with the Northwest New York Dairy Livestock and Field Crops team, and then Betsy Hicks with the South Central Dairy and Field Crops team. And they are our other two presenters that will be sharing information throughout the rest of the series. So at this time, we will start to answer any of your questions, and feel free to continue to submit those into the Q&A feature.
Yep, and we have one question submitted here. Haley Stan is asking, isn't the ear drooping for ear infections?
Yeah, so I would say that could be a sign of ear infections, but it could also be a sign of other respiratory issues like pneumonia. Do you guys want to add anything to that?
I was going to say, when a calf doesn't feel very well, that's kind of her overall demeanor as well. She'll kind of just have droopy ears in general, part of maybe how she's feeling a little bit depressed.
Yeah, and I'm actually glad that you asked that question, because I think that's another good reminder that it's not just one indicator is representative of one disease, but it's a combination of, her attitude, her temperature, and potentially other behavioral and physiological signs. And those are just things that you can look for to kind of help make your disease diagnosis or make your decisions if you need to have a vet interfere, and so on and so forth.
Okay, so I'm currently battling with what I think is lice, oily, flaky skin. They're not itchy. How do I make sure it's lice? Any recommendations for treatment or management?
I guess my suggestion for making sure that it's lice would be to try to get a sample, a skin sample, or if you can see the lice, and submit it to a diagnostic lab. For example, Cornell has their veterinary diagnostic lab. Probably your local vet is able to also run that test to confirm, and that would be the best action that I would say in terms of confirming that it's lice. Do you guys have other thoughts?
I'll always check with your vet as well. Likely lice are really difficult in the wintertime. And usually if they are itching and losing fur, they usually are lice, but certainly check with your vet, and you can send pictures, send samples, etc. But they should be really helpful to determine that. They can also tell you a treatment. Usually a pour-on will take care of lice pretty easily, but definitely check with your vet to make sure of what product you should use.
Okay, we have one. To your knowledge, do the apps that offer scoring capabilities also allow you to establish health records or refer back to, or what recommendations do you suggest for accurate calf health record keeping? So,
Alicia. Oh, sorry.
Alicia, you can go ahead if you want.
Yeah, I would say that a majority of the apps do let you establish records for specific individuals, and you can look back on those. Obviously, each system is going to be a little bit different depending on what they offer and what you can track and whatnot. We will talk pretty in depth about record keeping in the third session of this episode. And basically, the main takeaway is you have to do what works for you. So if you are tech savvy and you enjoy using apps, definitely go for it. There are a lot of options available, and based on what you want to track is how you can decide which one to use. But they should let you look back on those records.
Yep, and this has been recorded. This webinar has been recorded, and it's going to be posted on the Northwest New York Regional Team YouTube page tomorrow. So that's where you can find this recording again.
Everybody should get a follow-up email that will have that link specifically in it. So tomorrow sometime you should get a follow-up email that has that link in it.
Will our PowerPoints be available also?
Yes, the link to where the PowerPoints are is also going to be in that same email.
Okay, we have another question here. Is nasal discharge normal? The heifer calf average temperature is between 101.2 and 102.3. Holstein 180 question mark. Okay, so first let's go, is nasal discharge normal?
I would say that it's possible to have some small amounts of clear discharge that is normal. But if it's starting to be discolored or really excessive amounts of discharge, then odds are that's not normal at all. And you should really monitor that calf or get it checked, have your vet out. But we do see some amounts of clear nasal discharge as normal, but emphasis on the clear and not excessive amounts.
Okay, and
I
the
would second
normal,
that, Alicia.
yep, and normal calf body temperature is?
Sorry,
Question went away, sorry. I think the next question was asking what's the normal calf body temperature for a 180-pound Holstein. And for cows, it's 101.5, and it's a little bit warmer for calves. So 101.2 is gonna be a little bit low for that Holstein, maybe just a little bit, it depends. And then 102.3, you're still gonna be in an okay range, especially in the summertime.
Yeah, and like just looking at Wisconsin's vet scoring system, they're classifying normal as 100 to 100 point, or from 100 to 101. So I would say like even getting up past that, like she may not be sick, but it's worth paying attention to her and monitoring her and making sure that she doesn't start creeping higher.
And seeing if she has other symptoms of other things going on as well.
Okay, I don't see any other questions coming in. But as always, if you guys feel like you have more questions that come up, you can feel free to reach out to any one of us. We are just specialists in different regions, and you can find our information on our different websites, as well as the end slide for the specific presentation, which you can look at with that link that we'll send you in the follow-up email.
All right, thank you so much for joining us. We will see you next week. We're gonna be talking about dystocia and hard calvings.
Thanks, everybody.
Thank you.